So today we are seeing one of our pre-ops. She's about to have surgery in a few weeks, and I wanted to take this opportunity to go through her pre-op and tape it and educate. Any questions for me?
Incisions.
Where the incisions are?
Correct.
Okay.
And belly button.
And belly button. Great questions. So our incision is going to be placed super low here so that I can do a pubic lift. By the time I'm done, the incision is going to reside here. Through the incision, we're going to be elevating the skin and fat off of her muscle. She doesn't have much fat. Look at it. She's lost over 80 pounds of weight, by the way. We're going to be cutting around the navel, lifting everything up to here, and then I'm going to be tightening your muscles internally, okay? Then I'm going to pull this skin down as much as possible and then create a new opening and pull your belly button through that opening. Okay. So your belly button is going to be your own belly button. The opening around it will be revised and recreated elliptically, vertically oriented, and then we'll pull your belly button through. And then we'll be cutting all this excess skin and fat and closing that incision, okay? That would be your tummy tuck. That would be the end of surgery. Okay. That's how I finish. We also, on the front, are gonna do a thigh front lift. Let's look at that. See the difference between one thigh and the other? So this is lifting the front of the thighs. As a result, it also lifts the inner thighs, but you also have excess skin this way, right? This procedure is not correcting that. This procedure is lifting, and if we want to go after the excess skin of the thighs, we have to cut it that way in the future. On the sides, we're gonna be doing an outer thigh lift and a waist reduction. I hope you guys can see that. This is like 9 inches of excess skin that is gonna come together. We're gonna remove a good amount, maybe perhaps all of the stretch marks. And as we come to the back, those 9 inches of side skin are gonna be brought together. Through that, we're gonna do a buttock lift. I'm gonna utilize all of the lower back fat, which isn't much, and use that to augment her buttocks with it, like that. So I'll show it to you on this side.
Yeah, there's not much to it.
There isn't. It's really gonna be like folding this on itself. She's gonna end up with a much smoother buttock contour. The upper buttock will be augmented because this fat pad doesn't reach down here. It's really for augmentation of the upper buttocks in this stage. And then, as you can appreciate, we're gonna get a beautiful outer thigh lift out of it, okay? So you've asked me where are my incisions. Your incisions will be placed in such a way that you can wear this thong in the future and hide them, okay? So this is gonna be your future incisions. Now, usually when you do a lower body lift on a patient, the incisions migrate down about 1/2 inch to 1 inch within the first year. Okay. So we're gonna put your incisions a little bit higher, and then they will migrate down. So that means that you may have to adjust your thong a little bit up or down, okay?
Yeah. It's because I have a lot of skin laxity, so that was my other question.
You have
it's challenging skin.
Gain some weight.
I did, but then gaining muscle. I cracked the code, but I did it at my age, not 30 years ago.